Hello everyone. Today I'm going to explain some tips about the blood-brain barrier from radiological point of view. In our bodies we have arteries, veins, and a connecting network of capillaries in between. If we have a closer look on these capillaries, we can notice that these capillaries are lined by endothelial cells, and there are clefts in between these cells called intercellular clefts. In addition, there are many fenestrations in the wall of these capillaries. From intercellular clefts and wall fenestrations, the blood content apart from the cellular components can go from the intravascular space into the extravascular space or extracellular space, which is the site of exchange of nutrients and waste products between the cells of our body and the blood. Again, this is a diagram shows the intercellular clefts and capillary wall fenestrations. This happens in most of our body tissue. However, in brain, things are different. Going back to the history, in 1898, there were two doctors. One was a pathologist and the other was neurologist. They noticed that in cases of jaundice, all body tissue was stained with bile pigment except the brain. It seems that there is a barrier between the brain and bile pigment in the blood. It seems that there is a policeman who controls things going into the brain tissue. If we have a closer look on the capillaries in the brain, we can see that these are neuron cells, the astrocytes, which have multiple food processes which seals the pores and fenestration in the wall of the capillaries. In addition, the endothelial cells are tightly packed to each other with no intercellular clefts in between. To make it easier, the blood-brain barrier components are tight junction of the endothelial cells, the food processes of the astrocyte, and basement membrane in between. In a cross-section view, again, these are the tight junction between the endothelial cells, and these are the food processes of the astrocytes. So again, the components of blood-brain barrier are tight junctions between normal endothelial cells, the astrocyte food processes, and the basement membrane in between. This diagram shows the difference between the capillaries in the brain and rest of the body. Of course, it's not that easy. It's a more complex phenomena, as each single material has its own way of transportation across the blood-brain barrier. And here's the question. Does it matter for us as a radiologist to understand the blood-brain barrier? And the answer is yes, because what we do inject in our patient is the contrast material, which cannot pass through an intact blood-brain barrier. And based on this, if we look to the pre- and post-contrast CT of the brain, we cannot see normally any enhancement in the brain parenchyma by our naked eyes. Similarly, no enhancement in brain parenchyma can be noticed in post-contrast T1 weighted images. Before going through, I just want to explain one more thing. When we see an enhancing lesion in the brain, the enhancement depends on two factors. The first one is the amount of contrast leaked into the extravascular space, which depend on the the amount of contrast leaked into the extravascular space, which controlled by the integrity of blood-brain barrier, and the intravascular component of contrast, which depend on the vascular density of the tissue or the lesion. And that's why if we measure the density or the intensity of the brain parenchyma in pre and post contrast study, we will find some differences which cannot be detected by our eyes. And of course, the difference will be bigger in gray matter more than the white matter, because gray matter is more vascular than white matter. If we look to the pre and post contrast slide, we can easily find that there is enhancement in the pituitary gland, which is part of the brain, of course. So, is this normal? Again, what's this structures lying between the spleen of the corpus callosum and the tectal plate? It's the pineal body. In this pre and post contrast study, we can easily notice that there is avid enhancement of the pineal body in the post contrast study. So again, is this normal? In addition, look to the avidly enhancing choroid plexus in these slides. So again, is this normal? So here's the first step. Not every enhancement is pathological, because we have some CNS structures which do enhance physiologically in post-contrast study. For example, the pituitary gland, the vessels, the pachymeninges, the choroid plexus, and of course, dural sinuses. This is example of the normal meningeal enhancement in the post-contrast study. Look to the linear, non-continuous enhancement of the meninges. Look to the linear, non-continuous, very smooth enhancement of the meninges, and this is normal. Again, this is a slide shows the areas of physiological enhancement in the brain. Again, this is the normal enhancement of the meninges. This is normal enhancement of the vessels, of dural sinuses, of choroid plexus, and pituitary gland. So if there is any alteration of the blood-brain barrier due to inflammation, neoplasm, trauma, we will expect to see some enhancement at the area of the disruption of the blood-brain barrier. Look to these examples. This is a case of breast cancer with metastasis to the brain. Look to the meningeal enhancement. It's nodular enhancement and thick enhancement along the cerebellar folii, and this is a leptomeningeal metastasis, and this is of course abnormal. If you find a ring enhancing lesion in the brain, this is abnormal, whether it's open ring like in cases of multiple sclerosis, homogeneous thin regular ring in cases of cerebral abscesses, or irregular ring like in cases of GBM. If you have a cyst with enhancing nodule, like in cases of hemangioblastoma, of course, this is abnormal enhancement. This is a case of cerebral aspergillosis with nodular subcortical enhancement, and this is, of course, abnormal. Another example, the gyral enhancement in cases of meningitis. This is abnormal pachymeningeal enhancement, which is continuous and thick in cases of intracranial hypotension. The second tip is not every disease will enhance. And let's have an example. This is a pre-contrast MRI of the brain, and this is the post-contrast. Obviously, there is an abnormality here, which is of low signal intensity in T1, and in post-contrast study, no significant enhancement can be appreciated. However, look to the FLAIR images. Obviously, there is a space-occupying lesion or a tumor in this area. So, not every disease will enhance. One more thing to explain. There is a phenomenon called pseudo response. One of the famous drugs used in the treatment of cancer is Avastin, which is one of the anti-angiogenic agents. One of the mechanisms of the actions of Avastin is the alteration of vascular function and normalization of the vasculature of the tumor through restoration of the normal blood-brain barrier. Look to this example. This is the pre-treatment post-contrast MRI of a patient with a brain tumor. And this is the post-contrast study just 3 months later. We can easily notice that there is reduction of the enhancement of the tumor or the brain lesion at the right temporal region. Does this mean that the tumor has vanished? No, this is because of the restoration of blood-brain barrier, which prevent the leakage of contrast into the extravascular space, and that's why we will not see, or we will not expect to see, an avid enhancement like in the pre-treatment status. This is the same patient. This is a pre-treatment post-contrast study, and this is post-treatment contrast study. However, look to the FLAIR. This was the lesion before the treatment, and this is the lesion after treatment. It obviously has a significant increase in the size. So this is a progression or a progressive disease, not a regressive disease, in spite that you won't see enhancement in the post-contrast study like in pre-treatment status. And this is depend just on the alteration of blood-brain barrier, which prevent the leakage of contrast from the intravascular space into the extravascular space. So, in conclusion, blood-brain barrier is a complex physiological phenomenon. Contrast material enhancement in the central nervous system is a combination of intravascular enhancement and extravascular enhancement. Not every enhancement is pathological, and not every disease enhances. Thank you so much.